Have you ever left your doctor's office feeling relieved, believing that everything was fine, only to wake up a day or two later with dizziness, weakness, or confusion? In my 30 years as a neurologist, I have met so many patients with this exact story. They trusted the routine, they trusted the system, and still their brain paid the price. The truth is simple but often ignored. After the age of 60, your body no longer responds the way it once did. A routine test, a small pill, or even a late-night snack can place silent pressure on your heart and brain. What felt harmless at 40 can quietly become dangerous at 70. And sometimes the difference between safety and a stroke is just one overlooked detail. But let me be clear, I am not here to frighten you. I am here to stand with you, to shine light on the things that clinics, brochures, and even well-meaning doctors may not always explain. Once you know the truth, you can protect your brain, for it needs saving. You can walk stronger, think clearly, and live with the confidence that you are in charge of your health. So let me ask you something personal. Have you ever felt strange or off after a test, or after skipping a meal, or even after eating a so-called healthy snack at night? If yes, type the number 1 in the comments. If not, type 0. I read every response because your story might be the one that gives another senior hope, strength, and a longer, healthier life. Number 1, the harmless snack that triggers nighttime strokes. Every evening, millions of older Americans reach for what seems like a safe little treat before bed. It might be a handful of trail mix, a small bowl of popcorn, or even 2 squares of dark chocolate with tea. These foods carry labels that sound healthy, lightly salted, heart healthy, or rich in antioxidants. But after 30 years of treating patients with strokes, I can tell you that these very snacks, when eaten at the wrong time, can quietly place stress on the brain and heart. The American Heart Association has published findings showing that high sodium intake late in the evening is strongly linked to higher nighttime blood pressure. For someone over the age of 60, this is a major concern. Blood vessels naturally stiffen with age, which means they cannot expand and relax the way they once did. A blood pressure spike at night, when the brain expects calm and steady flow, can be the exact spark that triggers a clot or a vessel rupture. Let us break it down. A typical store-bought trail mix contains salted nuts and dried fruit coated with added sugar. A so-called serving, often just 1/4 cup, can hold more than 200 milligrams of sodium and as much sugar as a cookie. Popcorn, even the light bags, often carry 150 milligrams of sodium in every cup. And most people eat 3 or 4 cups without realizing it. Dark chocolate has its own hidden twist. While it contains antioxidants, a single ounce still carries caffeine, enough to raise heart rate and blood pressure for several hours. Combined with the natural slowing of circulation during sleep, this creates a dangerous strain on the brain. I think of a patient named Margaret, 71 years old, who switched from potato chips to trail mix, believing it was the smarter option. She was shocked when her evening blood pressure readings climbed even higher. Her healthy choice had simply replaced one danger with another. The lesson is not to give up snacks forever. It is to choose wisely. Fresh fruit, unsalted nuts, or a slice of apple with natural peanut butter will satisfy cravings without overloading the body. After 60, your brain deserves calm nights, not hidden stress. Have you ever noticed your blood pressure rise or your sleep suffer after a bedtime snack? Type the number 1 in the comments if you have. Type 0 if you have not. Sharing your story might help someone else protect their brain and sleep more peacefully tonight. Number 2, when your test preparation backfires. Every year, seniors across America head into clinics for blood tests, thinking it is a simple, harmless part of their routine care. You are told to fast, maybe to skip breakfast, and sometimes even to stop your medication for a day. It feels like the responsible thing to do. But what if these very preparations, done with the best of intentions, quietly put your brain at risk? In my 30 years as a neurologist, I have seen patients arrive at the hospital with dizziness, fainting spells, or even small strokes after what seemed like nothing more than a morning blood draw. The problem is not the test itself. It is how the aging body reacts to fasting, dehydration, and sudden medication changes. After 60, the brain is more sensitive to shifts in blood sugar, blood pressure, and hydration. That makes the common prep steps far riskier than most realize. Consider fasting. Many labs ask for 10 to 12 hours without food, but some patients mistakenly go 14 or more. According to the Journal of Clinical Endocrinology and Metabolism, older adults who fasted longer than 12 hours showed significantly higher rates of dizziness and mini-strokes during or after testing. Add dehydration, skipping even a glass of water in the morning, and blood becomes thicker, slower, and harder to pump. This combination can choke off blood flow to fragile brain tissue. Then there is the issue of skipping medications. I recall a patient, Samuel, age 73, who paused his blood pressure pill before labs because he feared it would affect results. Within hours, his unmedicated pressure spiked to dangerous levels, and he collapsed while leaving the clinic. The truth is, unless your doctor clearly instructs otherwise, never stop your regular heart or blood pressure medicine before a test. The risks far outweigh the small variations in lab values. So what should you do? First, confirm with your doctor exactly how long to fast. Usually 10 hours is enough. Second, drink water before your appointment, unless told not to. Hydration keeps blood flowing smoothly and makes the draw easier. And third, never skip medications without direct medical advice. Have you ever felt lightheaded after fasting for a test? Type 1 in the comments if you have, type 0 if you have not. Your experience could be the reminder that another senior needs to prepare safely and protect their brain. Number 3, the silent dangers of sedation in endoscopy and colonoscopy. For many older adults, an endoscopy or colonoscopy feels like a standard part of preventive care. Your doctor may say it is just a quick look, nothing to worry about. You arrive, receive sedation, drift off, and wake up thinking the hardest part is over. But what if I told you that the sedation itself can quietly strain your brain and raise your risk of a stroke? In 3 decades of practice, I have seen this hidden danger more than once. Sedation is not just about making you comfortable. Medications like propofol or midazolam relax the body, but they also lower blood pressure and slow circulation. For someone in their 30s, this drop is usually harmless. But after the age of 60, when blood vessels are stiffer and sometimes narrowed, even a brief reduction in brain blood flow can trigger trouble. The Journal of Gastrointestinal Endoscopy published a large review showing that patients over 65 who underwent sedated procedures had significantly higher rates of transient ischemic attacks, also called mini-strokes, within 72 hours. Many of these patients were also on common blood thinners such as aspirin, warfarin, or clopidogrel. That mix, sedation plus thinner blood, created the perfect storm for bleeding and circulation problems. I recall a patient named Helen, 76 years old, who went in for a routine colonoscopy. She had no symptoms, no complaints. 2 days later, she noticed slurred speech and clumsy movements on her right side. In the emergency room, tests confirmed a mild stroke. Doctors concluded that the sedation, combined with her daily aspirin, had lowered her brain circulation just enough to allow a clot to travel. The lesson is not to avoid these procedures completely. Endoscopies and colonoscopies can save lives by catching cancer early. But the key is to ask the right questions. Always tell your doctor about every medication you take. Ask whether sedation is necessary or whether a lighter option can be used. And if sedation is required, confirm how your medication should be managed beforehand. Have you ever felt groggy or off balance after a sedated procedure? If you have, type the number 1 in the comments. If not, type 0. Sharing your story could help another person recognize that what feels like just a routine test sometimes carries more weight than anyone expects. Number 4, contrast dyes and hidden chemical risks in CT and MRI. Most people believe that CT and MRI scans are the ultimate tools of safety. They picture high-tech machines, detailed images, and doctors spotting danger before it strikes. And in many ways that is true. But what patients over 60 are rarely told is that the contrast dyes used in these scans, those little injections that make pictures clearer, carry their own silent risks. As a neurologist, I have seen the same story repeated. A senior comes in for a routine scan, gets injected with contrast, feels a sudden warmth rush through the body, and thinks nothing of it. Then within a day or two, they experience dizziness, blurred vision, or a sense of fog. In rare but very real cases, those symptoms are the start of a stroke. The contrast dye places stress on both the cardiovascular and kidney systems. CT contrast, often iodine-based, can trigger rapid spikes or drops in blood pressure. MRI contrast usually contains gadolinium, a heavy metal designed to leave the body quickly. But after 60, kidney function naturally slows down. If the kidneys cannot flush the gadolinium fully, small amounts linger in the body, even in the brain. Studies published in radiology have shown that seniors with even mild kidney impairment have higher risks of complications, including stroke-like symptoms within the first week after a contrast-enhanced MRI. I remember a patient named Harold, 79, who had an MRI with contrast for back pain. 2 days later, he felt weak, confused, and unstable on his feet. Only after further testing did we discover he had stage 3 kidney disease, which made it difficult for his body to clear the dye. No one had checked before the scan. So what can you do? Ask your doctor, is this scan essential or can we do it without contrast? Request a kidney function test, often called a GFR test, before any contrast procedure. And always share if you have had unusual reactions to past scans. Now let me ask you directly. Have you or someone you love ever felt unwell after a scan with contrast? Please share your story in the comments. Your experience could be the very message that saves another person's brain. And remember this, asking questions at your appointment is not a sign of doubt. It is a sign of wisdom, of caring for yourself, and of protecting the life you still want to live. Number 5, the stress test paradox for aging hearts and brains. When most people hear the word stress test, they think of it as a smart preventive step. You walk on a treadmill while hooked up to a monitor, the doctor watches your heart, and you get reassurance that everything is working. But after the age of 60, this seemingly simple test can place unexpected strain on both the heart and the brain. Here is the paradox. A stress test is designed to push the heart harder, raising your heart rate and blood pressure. For a healthy 30-year-old, that pressure is no problem. But for someone with high blood pressure, stiff arteries, or fragile vessels in the brain, the sudden surge can be like lighting a fire in dry grass. It only takes one spark to create damage. A study published in the American Journal of Cardiology in 2020 followed more than 1,300 patients over 65 who underwent treadmill stress tests. Nearly 7% experienced harmful events, including dangerous spikes in blood pressure and irregular heart rhythms. The most vulnerable group was those who already had vascular problems. I recall a patient named Margaret, 74, who had lived with high blood pressure for years. She was not experiencing chest pain or shortness of breath, but her doctor ordered a treadmill stress test just to be sure. Halfway through, she felt dizzy and had tightness in her chest. The test was stopped immediately, but the following day she suffered a minor stroke. Doctors concluded that the sudden rise in her blood pressure during the test had ruptured a tiny vessel in her brain. The lesson is important. A stress test can be valuable if you are having symptoms like chest pain or shortness of breath. But if you are not, it may do more harm than good. Safer alternatives exist, such as a nuclear stress test using medication to simulate exercise, or a resting echocardiogram. These options may be better suited for seniors with vulnerable vessels. So before agreeing to a stress test, ask, is this test necessary right now? Is there a safer way to check my heart? These are not questions of fear, but of wisdom. Have you or someone close to you ever had a difficult experience with a stress test? Type the number 1 in the comments if yes or 0 if no. Your story may guide another person to pause, ask questions, and protect their brain before it needs saving. Number 6, the carotid ultrasound trap and unnecessary surgeries. At first glance, the carotid ultrasound seems like the safest test imaginable. No needles, no dyes, no loud machines, just a handheld device gliding gently over the neck, giving doctors a picture of the blood vessels that carry blood to the brain. For seniors, it often feels reassuring, like catching a problem before it starts. But hidden behind this routine screening is a trap that has led too many older adults down the path of risky, unnecessary surgery. Here is what often happens. A scan shows that the carotid artery is narrowed by 50 or 60%. The number sounds frightening, so the patient is sent to a vascular surgeon. Soon, surgery is being discussed. Procedures like carotid endarterectomy or stenting, which are designed to open the artery. The problem is that if you have no symptoms, no dizziness, no weakness, no vision changes, research shows that surgery may not offer much benefit at all. A major study published in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing but no symptoms. The findings were clear. In many cases, surgery did not lower stroke risk significantly compared to simply taking medication and making healthy lifestyle changes. Even more concerning, a small but real number of patients experienced strokes during or immediately after the surgery itself. I remember Helen, an 82-year-old patient who felt perfectly fine when her doctor suggested a carotid ultrasound just to be thorough. The scan showed 65% narrowing and marmusting, and she was rushed into surgery. Tragically, she suffered a small stroke during the procedure and has lived with partial weakness on her right side ever since. Her story is not unique. The key lesson is this: not every narrowing requires intervention. Arteries naturally develop some plaque with age, and in many cases, careful monitoring with medication and lifestyle adjustments is safer than surgery. If your doctor suggests a carotid ultrasound, ask, what are we looking for? What will we do if something is found? And if surgery is recommended without clear symptoms, always seek a second opinion. Now I want to ask you directly, have you or someone you love ever been advised to have a carotid ultrasound or surgery even though you felt fine? Share your story in the comments. Your voice may help another senior pause, reflect, and avoid an unnecessary risk to their brain and independence. Number 7, everyday devices that steal your sleep and stability. Not all medical risks come from surgery or powerful drugs. Some arrive in the quiet form of devices that look harmless. Take the Holter monitor, for example. It is a small heart monitor you wear for 24 to 72 hours to track irregular rhythms. Or consider the bone density scan, often followed by a prescription for high-dose calcium supplements. These tools are useful, but for seniors over 60, they sometimes bring side effects that few expect. Let us start with the Holter monitor. Imagine trying to sleep with wires taped to your chest, a small recorder strapped around your waist, and the constant awareness that every heartbeat is being measured. Many older adults tell me it feels like being under surveillance. That stress, combined with poor sleep, can raise levels of cortisol and adrenaline, the body's stress hormones. According to the National Institute on Aging, disrupted sleep in seniors is strongly linked to spikes in nighttime blood pressure. Those spikes quietly increase stroke risk, especially when arteries are already stiff or narrowed. Then there is the bone density scan, also called a DXA scan. The scan itself is safe and painless. The risk often comes afterward when patients are told to start high-dose calcium pills right away. Taken in large amounts, calcium can thicken the blood, making clots more likely. I once treated a patient, Linda, age 70, who doubled her calcium dose after a scan. Within weeks, she experienced chest tightness and numbness in her hand. Tests showed a small stroke, and her calcium levels were far above normal. Even fasting blood tests, another everyday procedure, can create hidden dangers. Seniors who go too long without food or water may become dehydrated or hypoglycemic. Thickened blood and low sugar create the perfect conditions for reduced brain circulation. So what is the lesson? Devices and tests are not inherently dangerous, but the way we prepare for them and the treatments that follow can place hidden stress on the brain. If you are scheduled for monitoring or scanning, ask your doctor how to manage sleep, medications, and supplements safely. Have you ever struggled with sleep while wearing a Holter monitor or felt uneasy after starting calcium pills? Type 1 in the comments if yes, type 0 if no. Sharing your experience could help others prepare wisely, protect their brain, and live with more peace of mind. Number 8, alone during a stroke, the 10-second survival plan. One of the most frightening realities of stroke is how often it strikes when someone is alone. It can happen at night, while you are cooking in the kitchen, or even when you are sitting quietly in your living room. In those moments, every second matters. Brain cells begin to die within minutes, and hesitation can mean the difference between walking again and permanent disability. That is why having a survival plan, one you can remember even in panic, is so critical. The very first step is simple but life-saving. Call 911 immediately. Do not wait to see if the dizziness, numbness, or slurred speech will pass. Saying the word stroke to the dispatcher alerts emergency services to respond with maximum urgency. Even if your speech is weak, keep the phone on speaker. Background sounds and breathing patterns can help them locate you. Next, protect yourself from injury. Strokes often cause sudden weakness or collapse. If you feel unstable, lower yourself to the ground or onto a bed. Lie on your side with your stronger side down. This position stabilizes your body and helps keep your airway open. Tilt your head slightly back and use a pillow or blanket to gently elevate it. If you can, unlock your door or leave it open a crack so paramedics can reach you without delay. While waiting, conserve your energy. Resist the urge to pace or push through. Keep movements minimal, breathe slowly, and focus on staying alert. Simple mental cues like repeating your name, the word stroke, or the time can help you stay conscious until help arrives. I recall a patient, David, 68, who felt his arm go numb late at night. Because he had practiced these steps, he immediately called 911, lay on his side, and unlocked his door. Paramedics arrived within minutes, and he was treated quickly. Today, he walks without a cane and tells others that knowing what to do saved his independence. Now I want to bring you into this conversation. Have you ever thought about what you would do if a stroke struck while you were alone? Type the number 1 in the comments if you have prepared a plan. Type 0 if you have not. Your story might inspire someone else to prepare today, and that preparation could save a life tomorrow. Number 9. Lessons, hope, and your next step. After walking through these hidden risks, one lesson rises above all others. Not every test is dangerous, but not every test is necessary either. The truth is that after 60, your body responds differently than it did decades ago. What once seemed routine, a stress test, a contrast scan, or even a bedtime snack, can now quietly tip the balance toward harm. The key is awareness. When you know the risks, you can protect your brain before it needs saving. Awareness begins with questions. Ask your doctor, is this test essential right now? Are there safer options for someone my age and condition? Those questions are not signs of doubt or mistrust. They are signs of wisdom. In 3 decades of practice, I have seen that patients who ask, who pause, and who seek second opinions often avoid unnecessary risks and live with greater independence. Hope lies in the fact that most of these risks can be reduced with small, thoughtful steps. Drinking water before a fasting test, avoiding high-salt snacks at night, choosing lighter sedation, or confirming kidney function before a contrast scan. Each action is simple, yet powerful. These choices add up, protecting your circulation, your memory, and your ability to keep living fully. I think of Helen, who once faced a stroke after an unnecessary procedure. Today, she encourages others in her senior group to always ask why before saying yes. Her story proves that even difficult experiences can become lessons that protect others. That is the spirit of community we want to build here. And now I want to invite you to join that community. Have you or someone you love ever faced a surprising complication after a routine test? Share your story in the comments. Your voice may be the encouragement another senior needs to pause, to reflect, and to choose wisely. If this message has opened your eyes, subscribe to the Dr. Brain channel. Together, we will continue to uncover the truths that protect your brain and your future. And as you move forward, remember this: every wise question you ask, every careful choice you make, is a step toward living longer, stronger, and with the clarity you deserve. We have traveled together through the hidden dangers that often hide in plain sight. Snacks that seem harmless, medical tests that feel routine, and preparations that appear safe. Each of these moments, when overlooked, can put silent pressure on the brain. Yet knowledge is the bridge that turns fear into strength. When you understand the risks, you can ask better questions, prepare more wisely, and protect your independence. Here is the message I want you to carry with you. Your health is not just in the hands of doctors, hospitals, or machines. It is in your hands too. Every question you ask, every small decision you make about food, tests, and daily routines becomes an act of prevention. Think of it as building a shield around your brain, one thoughtful habit at a time. I also want you to feel hope. It does not have to be a sentence of decline. I have seen seniors in their 70s and 80s reverse muscle loss, improve balance, and lower their risk of stroke simply by adjusting their habits. A glass of water before a test. A walk after dinner instead of a salty snack. A calm conversation with a doctor before agreeing to a procedure. These changes may look small, but over time, they are life-changing. Now I invite you to pause and reflect. Have you ever noticed how your body feels after a test, after a late-night snack, or after a restless night? Share your thoughts and stories in the comments. Your voice might be the one that helps another senior recognize their own risks and take action. If this video has given you even one piece of clarity, I encourage you to subscribe to the Dr. Brain channel. Together, we are building a community where knowledge leads to longer life, stronger health, and brighter mornings. And if you are ready for the next step in protecting your brain, do not miss our upcoming video, one common sleeping position that can trigger stroke overnight. It will reveal how something as simple as the way you rest your head at night could be quietly shaping your brain's future and what you can do about it. Stay safe, stay curious, and remember, protecting your brain today is the greatest gift you can give your future self.